This lecture is about the management of hyperthyroidism, which consists of three treatment options. The first one is the medical management, which consists of drugs known as thiazide, and this has been discussed in details in my previous lecture. The second treatment option is radioactive iodine treatment, and the isotope that is commonly used is iodine 131. The third treatment option is surgical ablation of thyroid gland. In this lecture, I will be comparing the indications, contraindications and drawbacks of radioactive iodine and surgical treatment of thyroid gland. So let's begin with radioactive iodine treatment, which uses iodine 131 isotope for ablation of thyroid gland. It is administered orally as a single dose at a dose of 5 to 15 millicurie in empty stomach or after a light meal. The effect of a dose is apparent after 3 to 4 weeks, and the maximum effect is achieved by 3 to 6 months. So it takes 3 to 6 months to achieve maximum effect. About 50% of the patients become euthyroid with a single dose, while others may need a second or a third dose. But the decision for the second dose is taken after the end of 6 months, because the full effect of radioactive iodine treatment takes about 3 to 6 months to achieve. Now let's see, how does radioactive iodine work. Radioactive iodine, when administered orally, is selectively concentrated in the thyroid gland, from where it emits beta particles and gamma particles. Both beta and gamma radiation have distinct roles in the management of hyperthyroidism. When it comes to beta particles, they have cytotoxic action and they can travel for short distance within the thyroid gland, about 0.5 to 2 millimeter. Since they can travel short distance in the thyroid gland, they cause localized destruction of the thyroid gland, causing ablation of the thyroid gland and decreasing the excessive production of thyroid hormone, and helps in controlling hyperthyroidism. While on the other hand, the gamma particles have high penetration capacity, so they can penetrate through the thyroid tissue and is detected by imaging devices. So gamma particles help in thyroid scan, they are useful in thyroid imaging. Therefore, the beta particles have a therapeutic role in the management of hyperthyroidism because of their cytotoxic action, and also because they can travel for short distance, that is 0.5 to 2 mm, causing localized destruction of the thyroid tissues while not disturbing the other surrounding tissues. Whereas the gamma particles have high penetration capacity, they have a diagnostic role, they are used for thyroid imaging because of their high penetration capacity, and they are detected externally with the help of imaging devices and have a diagnostic role in the management of hyperthyroidism. Now let's discuss the indications of radioactive iodine treatment. Radioactive iodine treatment is used in patients above the age of 35 years. So it is not preferred in a young patient, because radioactive iodine treatment often leads to permanent hypothyroidism, and this may require long-term replacement therapy with levothyroxine. Also, when administered in reproductive age group, the young woman is advised to avoid pregnancy for at least 1 year after radioactive iodine treatment. So it is not preferred in young women or in reproductive age group. But if the young patient is suffering from a severe systemic disease that contraindicates surgery, then radioactive iodine treatment may be used. The second indication is recurrent hyperthyroidism after adequate treatment with drugs such as thiazide, or post-thyroidectomy after surgery if there is recurrence of hyperthyroidism. The third indication is allergy to thiazide. If the patient is intolerable to thiazide, then radioactive iodine treatment may be used. The next indication is toxic multinodular goiter and toxic adenoma. So these nodules are autonomously functioning nodules producing excessive thyroid hormone production independent of TSH regulation. So to control the thyroid hormone production by these nodules, the definite treatment is radioactive iodine and surgery. Now for surgery, if the patient is unfit for surgery, he is suffering from multiple comorbidities in older patients, or there are contraindications for surgery. So radioactive iodine treatment is used in these patients. In severe cases of hyperthyroidism, the patient is first made euthyroid prior to radioactive iodine treatment to increase the responsiveness to radioactive iodine treatment. So what are the contraindications to radioactive iodine treatment? Pregnancy is an absolute contraindication of radioactive iodine. This is because the radioactive iodine crosses the placenta, reaches the fetus and can affect the fetal thyroid gland. This can lead to congenital hypothyroidism or cretinism, and it can also affect the overall growth development of the fetus. It can lead to birth defects and miscarriages. Therefore, pregnancy is contraindication to radioactive iodine. It is also contraindicated in children because it can lead to long-term hypothyroidism, can affect the growth development of children, can affect the pubertal changes. Now let's move on to the indications and drawbacks of surgery in the management of hyperthyroidism. The first indication is large goiter or compressive symptoms, compression of trachea causing dyspnea, compression of the esophagus causing dysphagia, or compression of recurrent laryngeal nerve causing hoarseness of voice. Malignancy or cancer is an important indication for surgery. Surgery is preferred in a case of cancer which infiltrates, which exerts pressure on trachea, esophagus. Multinodular toxic goiter or diffuse toxic goiter or solitary toxic adenoma are also important indications for surgery because they are autonomously functioning nodules producing excessive thyroid hormone. So surgery and radioactive iodine are definite treatments in such conditions. Next is recurrence after radioactive iodine treatment or failed medical management. Coming to the drawbacks of surgery, there is a risk of complications associated with removal of thyroid gland. Hypothyroidism is inevitable with removal of thyroid gland, and this may require lifelong replacement therapy with levothyroxine. Injury to recurrent laryngeal nerve can cause hoarseness of voice. Injury to parathyroid glands can cause hypocalcemia and hypoparathyroidism. Also, there is a risk of post-operative bleeding, and this can cause neck hematoma or complications and can cause compressive symptoms. Also, surgery requires hospitalization and general anesthesia. Unlike radioactive iodine treatment, which is a simple procedure, an oral injection of radioactive iodine can cause thyroid ablation, decrease the thyroid hormone production. High cost is involved with surgery compared to radioactive iodine, which is cheap and easily affordable. Also, surgery is not a preferred option if the patient is suffering from severe comorbidities, severe systemic disease, or in older patients there is high surgical risk. So surgery is avoided in such patients. Also, surgery requires hospitalization and general anesthesia, unlike radioactive iodine treatment, which is a simple procedure and requires oral injection of radioactive iodine, and this produces hypothyroidism. This helps to control hyperthyroidism. High cost is involved with surgery compared to radioactive iodine treatment, which is inexpensive, it is affordable, it is cheap. Also, surgery is not suitable for elderly patients with severe comorbidities, with severe systemic disease and with high surgical risk. So in such patients, radioactive iodine treatment is preferred. So in this lecture, we have discussed the indications, contraindications and drawbacks of radioactive iodine treatment and surgery. So if you find this video useful, please like, share and subscribe. Thank you for watching.